You have questions? We have answers. Welcome to the Therapist Question Box with your host, Miss Lindsay Schiss.
Welcome back to another episode of the Therapist Question Box, where we are not afraid of anything, so ask away. We are here to tackle your tough questions. Today I have with me Brannon Patrick, and this episode is actually a continuation of our episode about diagnosing. We did an episode about diagnosing being helpful, and this episode we are going to talk about the flip side, when diagnosing can be harmful. So really, mental health diagnosis can provide clarity, but it also can be perceived as harmful. In what ways can it be harmful? I think we know some of them. It can feel stigmatizing. It can impact self-esteem and relationships. Today, we're going to follow up on that conversation around diagnosing and maybe some of the concerns that we might see, Brannon might see as a therapist around diagnosing. So really, Brannon, this is a hot topic. Everyone, it seems like, is diagnosing these days. When you think about the concerns around diagnosing, what comes up for you? What are some of the concerns that you might have?
Wow, there's actually quite a few. Anything from misdiagnosing, so it gives people the wrong idea as to what's going on, to using diagnosis to manipulate things in life. Also, diagnosis turning into somewhat of a self-fulfilling prophecy or an identity can be a big problem. So there's just a few off the top of my head.
Yeah, and those are all significant, right? The tricky thing is how do you know that's gonna be the outcome? Who knows that this diagnosis might be the greatest thing ever, and all of a sudden there's clarity. And who knows if you're gonna have the child or yourself are gonna be that one that this feels like a self-fulfilling prophecy, right?
Yeah, I think from my experience, from what I've seen with people, when diagnosis is helpful, it's information that is based in reality and truth. When diagnosis is unhelpful, it's information that's not true, for like if you just get a wrong diagnosis, or it's information that's being used to manipulate. And that's kind of the differentiation between helpful and unhelpful, I would say. And I think sometimes people come by their getting diagnosed problems honestly. Like what I mean by that is, like, I have a friend who is diagnosed with depression, whose mom was diagnosed with depression, whose grandma was diagnosed with depression. Depression is their family. Like, it is like they are all depressed, right? Now, I'm not saying they're not. They might legitimately have a mental health diagnosis with depression. But at the same time, it makes me wonder, is there something else going on here? Is this actually based in reality or not? I don't know. I'd have to do further analysis to understand, right? But if it's not based in reality, then I think that's problematic and it causes harm to people.
Can you tell us, what do you mean by it's not based in reality? Can you explain that?
Yeah, like let's use this example. Let's say I'm depressed because that's my identity, because that was my mom's identity, my grandma's, and everybody's identity, right? If I start to believe that I'm depressed, I'm going to act like I'm depressed. If I act like I'm depressed and I believe that I'm depressed, how am I going to feel?
Depressed.
Yeah. Right? Versus like a chemical imbalance in my brain where now that can lead to depression, right? It can, but it's a chicken or the egg thing. Am I creating this because it's like what I believe, versus I have an imbalance in my brain? The chemicals in my brain really are off here. My brain's not firing the way that it's supposed to, like something's broken in my brain, and that's why I'm feeling the way I'm feeling. So, yeah.
It's so hard though, because how do you know what's a chemical imbalance? What's just a hard time? What's clinical depression? I mean, if a person that's struggling, it's really hard to go, okay, what's really going on here? And I mean, this is why we have experts, right? But trying to differentiate that is really challenging.
So there are tools to differentiate. So like I know addiction the best. And with
Mhm.
addiction, you can find it in the DSM. Also, there's the thing called ASAM dimensions that we use, where we go over a person's life and look at so many things about their life and understand, is this actually an addiction or not? Um, and so, like, addiction is a good example because you can take it and you can see pretty clearly when there's an actual addiction. Sometimes people will call themselves addicts when it's like, I wouldn't diagnose you with an addiction.
Mm,
But they're acting like they have an addiction and they're, doing all the things. Um, and so, yeah, to be very clear with what are those markers, right? Like, I really want to look at this and understand what are those markers and do I fit that criteria?
yeah.
Not.
And that's it. That's where I would imagine, and I believe as a therapist, it's really important to not try to self-diagnose because I can't be objective looking at myself. I also can't be objective really looking at my kids or my husband because they're just too close to me. There's too many emotions, there's too many things going on. So if I can go to somebody else, it can be beneficial, right? But today we really want to focus on the harm that can happen in a diagnosis. And I'm sure you've seen harm that has happened when a person has been diagnosed. And
Lindsay,
go
before
ahead.
you move
Go
on,
ahead.
I got to tell you a story because it fits
Okay.
here so
I'm
well.
ready.
I went off gluten for 3 years. And because I knew I was getting brain fog and fatigue. It was like, it's got to be the gluten. It's
Wow.
got to. So, and then I actually decided I'm going to go get the tests. And all the tests came back like, you're good with gluten. This is after 3 years of not
Oh
eating.
my word. Wait a minute. You went off for 3 years and didn't test?
Yeah, I didn't test. I just like
Brandon.
self-diagnosed, and I go to the doctor and she's like, let's check out some other stuff. She did some blood work. She found out my testosterone was really low and stuff. And so like I get the blood work, I start working on the hormones, and I start feeling great. And now I can eat donuts
I
and
was
feel
gonna,
great.
right? And you're like, I just hit the jackpot. I get to have gluten and I get to feel better.
Yeah, I
And
shouldn't be eating the donuts, but um but do you see the point here? Is like
totally.
I self-diagnosed. I knew it myself. Google helped me diagnose it all. I knew, and it was like I was off. And until I got that blood work and the science behind what was actually going on in my life, did I realize what was actually happening, and it informed what I did from there. Um,
Yes.
and so I do think what you said about not self-diagnosing is important,
Yes.
especially in today's day and age when we have type in chat GPT, like your symptoms, and it'll diagnose you.
You bet.
But it's so complex that I think you do need expertise in order to give you that diagnosis.
Absolutely. Well, I can think about that from a physical. First of all, I'm sorry you wasted 3 years of your life not
I
eating
know.
donuts. That's a
My
real
gosh,
bummer. Jeez.
pizza. Like, oh
Life
man.
could have been so much better for you, but I'm glad you got it. You're on the other side of it now. So
Yeah.
here we are. But I really do think, I think about even physical symptoms that I've had. And when I WebMD my physical symptoms, boy, it can pull up things that scare the crap out of me, So
Cancer, like
yeah.
all
And all of a sudden I've got a
endocrine.
cold and I'm dying. I go from I got a
Yes.
cold to like, right. And I think, okay, the same principle applies from a mental health perspective that
Yes.
we really can jump ahead of ourselves and it's really hard to stay in a position of being objective. So this is why we have mental health professionals that can help do that. So
Yes.
really when we talk about the harm, self-diagnosing is often harmful. I can see there's a balance. It's like, okay, I don't feel good, so I'm going to maybe consider my diet here, right? Like you did. But maybe not jumping to the full gluten-free thing, right? So same
Right.
principle at like with, I'm feeling like I can tell my body that my heart's racing and I've got knots in my stomach. That doesn't feel normal to my everyday. Something's off here, right?
Right.
Getting curious about that is very different than I'm going to go to a full-blown diagnosis, right? Getting curious, wondering what's going on. There's a big difference there. I'm not saying be naive, but I think there's a big difference.
Right. Yes.
Okay.
And so it's listening and noticing and understanding that the symptoms are there, but not jumping to conclusions. And I think when we jump to conclusions and make assumptions, that's when it becomes a problem.
Absolutely. So this actually leads us to our listener question. It's really actually kind of right in line with this. The question is this. After reading some online forums, my daughter has self-diagnosed herself with anxiety. I am concerned. It could be anxiety, but it also could be normal teenage angst. How can a mental health diagnosis label affect a person's sense of identity and self-worth? So a concerned mother, you can hear it in the question.
Totally. Um, it's interesting diagnosing yourself with anxiety. We all have anxiety to a degree. Anxiety in and of itself is not a mental health disorder. Like it's just anxiety. Um,
Isn't
and
it problematic that we have this feeling that is also a disorder? Yeah, like to
yeah,
me, that is problematic. That actually it's the same, we're using the same word.
we use the same word.
Yeah.
Yeah,
So
but
it feels confusing.
it's not a mental health problem to have anxiety. We have anxiety.
Right.
And sometimes anxiety is really important for us with certain things. Now, it
You know,
can go ahead.
sorry, it makes me think of Inside Out too, right? And anxiety is this new character. Have you seen it yet?
I haven't seen it yet,
Okay.
but
Oh, it's so good. But anxiety is this new character, and she, comes on the scene and she's kind of wreaking havoc. And it's actually like at one point, this character anxiety says, I'm actually just trying to help. I'm really just trying to help, right? As opposed to wreaking havoc, like it feels like she's doing in the system. It's really like, actually, I'm just trying to help. So when you say that, it makes me think of that. Like this is a really important part of us, but figuring out when it gets too big or overtakes the whole system, right? As I'm thinking about this Inside Out too, and all these parts are doing their job. It's a needed part of the system, but when it gets too big, it's something to be concerned about or be aware of.
absolutely. I think of like my 16-year-old daughter. She's definitely got feelings going on inside of her, going everywhere.
Yep.
And that she's a 16-year-old. Like that is normal. So coming back to the question, um, I think the concerned mother is spot on here with her question. And what I would do if I were her is offer some resources or ideas to actually understand it better.
Mm.
So instead of going to her and saying you're overreacting, if you go tell someone with anxiety that they're overreacting, they're going to have anxiety about overreacting. So I would instead say, hey, let's really figure this out. If you think that you do, then let's actually try to understand it. And maybe you'll find that it's not the gluten, maybe it's the testosterone. I don't know.
Yep,
Don't say that to your daughter, but maybe you'll find that it is the gluten. And if you do, then we'll go from there. But let's first, before we jump to the conclusion or make the assumption, let's take pump the brakes a little bit and get some more understanding and some more help.
So good. I love that idea. And as I'm thinking about it, as at me as a parent, I'm thinking I really have to also manage my own discomfort around this, because that might be challenging for me to think about my child having anxiety or whatever. That I might have my own experience, and I probably do, around anxiety or one of these diagnoses that might be really challenging. So it's again, I love the idea of like, let's get some more information. And I think in the meantime, as a parent, you've really got to get aware of what's going on inside for you as well.
Yeah, I think that's really good advice, because like we're scared of diagnosis. What does that mean? What will people think? I want to push against this because yikes. So like, does it mean I'm a bad mom? Like like, no, let's just figure it out. Like, this isn't about you. Like, let's figure it out.
Oh,
Um, right.
and separating those things, it's not about you, is sometimes really hard as a parent, right? We see our kids as a reflection of us and what didn't I do and how did I cause this? But if we can step back and look at them as unique individuals, then maybe we can be a little more removed from it and help them.
Yeah.
Okay.
Yeah, exactly.
Okay. Well, our second question is from a listener, and here's what it is. Here's the question. My husband started seeing a therapist and has been given a diagnosis of depression. How might this diagnosis influence his relationship with family, friends, or colleagues? Do you think it will lead to misunderstanding or a change in the dynamics?
Huh. Um, it really matters whether or not that diagnosis is a good diagnosis or not.
Hmm.
So if it is, that means hopefully he takes it and he starts to work a treatment plan around that diagnosis, and his relationships improve and get better, and his life gets better because he knows he struggles with depression. So he's managing it really well and things get better. That would be the best, right? Let's say he got diagnosed with depression, but he's not really struggling. Like, it's not really depression. Maybe it's other things, lack of motivation, laziness, who knows what, right? Now, does that just give him an excuse to lay around all day, do nothing, isolate, woe is me, play the victim to life because I got this diagnosis of depression, right? So you can see it can go either direction depending on what is actually happening. So assessment is key.
So when you
And
say make sure it's a good diagnosis, how do you know if it's a good diagnosis? And when you say assessment, is that what constitutes a good diagnosis? Like if I'm coming in to a healthcare provider or to a therapist, to a psychologist, how do I know?
I think if it were me, and this is where people like, if I were going to, let me give you an analogy here. If I were going to get heart surgery, would I just go to the cheapest guy?
Definitely not.
Probably not, right? Why?
Because my heart matters and it's yeah, you want to make sure your heart's taken care of and you're not going to just go and get a discount heart surgeon because it's
Right,
cheap. It matters.
right. So like, if I had a Ferrari, would I take my Ferrari to like the cheapest mechanic to fix it that like I could find, just to like give me a quick fix on my Ferrari? No, I wouldn't.
Right.
Right. So, but that's what a lot of times we do with our mental health. It's like, well, let me just go get the quickest, easiest answer that I can get because, um, like, and oh, so and so said I have depression, so I guess I have depression.
Mm.
Well, I'm going to put in the work and the time and even the resources, the money to figure out if I'm really struggling with something, addiction, depression, bipolar, borderline, personality disorders, whatever it is. If I feel like I'm struggling with something, then I'm going to put in the effort to find the experts. Now your question is how do you find them? Word of mouth,
Okay.
reviews online. Online reviews are awesome. They'll tell you what's good, what's not. Educate yourself about professionals. With mental health, there's all different kinds of licenses and all different kinds of people. Do you know the difference between a psychiatrist and a psychologist and a social worker and a mental health counselor? Like, I could go on and on, right? Today, you and I were talking, and I was like, "Oh yeah, that therapist," and you're like, he's not actually a therapist, right?"
Yeah.
So to like understand who are these people, what's actually going on, put in the time, the effort, the energy, and the resources to actually really know. And there's also, depending on what you're wondering about, whether you're like, if you have a diagnosis or not, there's usually good assessment tools. And for most things, there have been good assessments made to understand whether or not there's a diagnosis here or not.
Okay. So really do your homework. That's what I'm hearing. Do your homework.
Do your homework.
Yeah. Don't bring your
your
Ferrari.
homework isn't, oh, I feel down today, I'm going to Google if I'm depressed. Oh, it says I'm depressed.
Right. Or go off gluten for 3 years. I mean, I don't know. I'm just throwing that out there. It's good. So do your homework, right? And, again, from this question I'm hearing, it could lead to misunderstanding. It could change the dynamics. Fear's a normal part of a diagnosis or a family member looking down the barrel of a diagnosis. And I don't even want to use that term, looking down the barrel, but there's some fear that's attached to that. How would you support this woman who's saying that her husband has been, diagnosed with depression? How would you support her? Because you can hear the fear that's coming through in this question.
Yeah. I mean, I would really try to help her understand what's in her control and what's not. Help her understand how to best support her husband, but also take care of herself and stay in her truths. And then help her maybe grieve a little bit, the reality of what's going on and understand what that is and what is that process of grief to actually understand this. So if it actually is depression, what does that mean? And a lot of times, Lindsay, what happens with a family member is that you say, look down the barrel of the diagnosis, but when the diagnosis comes, they're like, no, duh.
Yeah.
Like, yeah, I know.
It all fits. It makes sense.
Yeah. Finally, they went and got some help and they were like told that this is what's actually going on. I've known this for freaking years. Like this is, yeah. So now what? Now
that can be so relieving, I would imagine. Like to say, oh, it makes sense now. It's not just, it doesn't feel personal or, to me or to them. Like there's a reason behind this, the frustration, the behavior, whatever.
Right.
Yeah.
Right.
It makes sense. Well, such an important conversation, Brannon. I really appreciate your insights on both how diagnosing can be helpful as well as how it can be harmful. I really hope people listen to this and take it into consideration for themselves as well as their family members and friends, because it is something that, boy, mental health is becoming a hot topic and it's awesome. And there's some big things to consider, right? The implications of a diagnosis and ensuring that it really enhances rather than detracts from a person's well-being.
Don't go off pizza for 3 years if you don't have to.
Don't do it. Your life could be better. Listen to Brannon. He'll tell you. Well, if you like this episode, please share it with your friends, rate and review, and we'll see you next time.